I'm Dr. Safiuddin Nadwi, orthopedic consultant in Apollo Spectra Hospital. I do joint replacement surgeries and arthroscopic surgeries and trauma surgeries in this center. Joint replacement surgery is another advanced surgery in orthopedic where we replace the arthritic joint, especially in the hip joint, knee joint, shoulder joint, and ankle joint. But most commonly, the hip joint and knee joint replacements are very common, as most of the patients they have arthritis of the hip and the knee. Uh, these patients can be treated conservatively by giving them a proper physio program, and also along with that we give medications to preserve the joint as far as possible. Once the patient is in grade 1, grade 2, they do very well with the physio and with the medications. If they and a most important thing is that they have to leave out their sedentary life, where mostly now the world they have a sedentary life. They don't like to do exercise. They just eat, and their sleep patterns are very different. So these things are to be modified. When the patients they come to me, we counsel the patient regarding their eating habits, sleeping habits, their walking posture, their sitting posture, and all these important things has to be taken care of. And once the patient, we analyze the patient. Once they come to us, if they have a pain, there are certain criteria before we decide for a joint replacement surgery. If especially in the hip and the knee, when they have a pain for more than half an hour, when they can't walk more than 30 minutes, they have a waddling gait, they have difficulty in walking, the knee or locks up or the hip locks up, they have difficulty in squatting or sitting down, using Indian bathroom latrines. So that is the time where they come to us, and we do the a clinical examination. We do a radiological examination. We take an X-ray. We examine the patient in our OPD. On the basis of that, we decide to do whether the patient is requiring to do a total knee replacement or total hip replacement. Is been analyzed on the X-ray, clinical examination, and the questionnaire which we provide to the patient, how their lifestyle is and how difficult for them is to bear the pain, and they're not having satisfaction with with the painkillers. So that is the place where we advise them for the total knee replacement or hip replacement.